Hello, Dr. Keith Smith with you once again, Surgery Center of Oklahoma. We're back here with part 2 with Dr. Jeff Davenport, whose website is
www.onefocusmedical.com. That's the word onefocusmedical.com.
And as you saw in the previous segment, his practice model is a little bit different. It's kind of a subscription model. It's not a typical fee-for-service model, and it spends a lot of time with his patients. He doesn't charge them very much. He's like the happiest doctor I know, maybe next to me. So I've wanted you guys to understand a little bit more about his practice. How many employees? You must have a lot of employees to see all of these patients. And I mean, how many employees do you have?
That's actually one of the biggest differences. We only take a certain number of patients. In this particular model, only about 600. The average PCP has about 3,000. So 80% fewer patients. I only have one employee. Actually, one of these days we'll hire on other physicians, and there will be one full-time employee per 2 doctors. So the overhead is drastically decreased. I rent a single office, a single room from one of our local specialists because I only need one room. I only see about probably an average of 4 people a day. The most people I've ever seen in this style of practice at this point was 8. And in my old style of practice with the fee-for-service, I used to see 12 a half day. So you can see the difference in the amount of time and the ability to take care of people. But overhead is drastically decreased because we just don't have all the paperwork and all the insurance burdens and all the documentation issues. And when I'm not in a patient room, I'm the one who answers the phone because the patient wants to talk to me anyway. And so I don't have to have a whole bunch of staff up at the front taking care of all that stuff.
What has been the reaction of the patients, particularly those who saw the old way and now see the new way? What is their reaction to this type of practice?
Well, they're just thrilled with the access. I think more than anything else, all the layers of interference between the doctor and the patient. And some of it the doctor drives. You know, when you're seeing 25 people a day, you hire people at the front desk to keep your patients away from you so that you can get through that 25-person day. I know there's primary care doctors out there who recognize that in themselves. And that's been what's most wonderful to the patient, I think, is the fact that when they call the front desk, I answer the phone. When they email me, when they text me, I'm the one they're interacting with versus having multiple layers. And that just facilitates care. I mean, that's the bottom line, is it just facilitates how well we can take care of people.
A lot of physicians I know feel like they're trapped in hospital employee arrangements. Lots of primary care guys who, they didn't want to comply or didn't think they could comply with ICD-10 or the electronic medical records. Their overhead was getting to them. What would you say? What kind of message would you give to a physician that is, say, a hospital employee who feels trapped?
Well, you mentioned ICD-10. I usually make the joke, what is that? Because to be honest, I type into the chart hypertension. I don't code or anything. I don't worry about how to document all the visits, this many points of physical exam and this many points of medical decision making and et cetera, because I no longer have to justify the need for my reimbursement. I document into the medical legal document the medical and legal appropriate things. And those are the types of things that when you eliminate that stuff, all of a sudden medicine becomes fun again because you're just taking care of the patient and you're not worried about what everyone else is going to think about you. You're not employed by someone. You don't have to answer to them. There are still some obvious, medical legal things, HIPAA, for example. I mean, most of that is just common sense. Okay, well, I'm not going to talk about HIV in front of the whole office staff, but the reality is there's so many regulations if you're employed and from the insurance agencies and from Medicare and from everyone else that when you stop taking insurance, when you stop taking Medicare, when you're no longer employed by someone else, all of a sudden you're just a doctor and you get to practice medicine again. And that's awesome because that's pretty much what we wanted to do to begin with.
It's a very hopeful message for someone who feels trapped. not only because medicine can be fun again, but it sounds like they could land in an almost zero overhead situation,
Right.
and so there wouldn't be a lot of business or financial risk to entertain this kind of a model.
Right. I think, going way back to when I started practice, at that time I heard the average expense to start a new practice was around $100,000. Well, here's the thing. Your overhead is so low in a situation like this. You just need a small space. You need a phone. You need a cell phone. You have maybe an employee. For the first 3 or 4 months, I didn't even have an employee, because I'm answering the phones, I'm doing the referrals, and I only, had 100 people to take care of for several months. But I think people, especially here in the state of Oklahoma, will advance faster than I did because there's several people around the state doing what I'm doing right now, and we are kind of creating the pathway where the next round of doctors who come on and start doing this, some of the steps will have been hammered out for them already, and I think they'll increase in numbers faster. And if you remember, average primary care doctor has 3,000 patients. This model only requires 600. You don't need that many people to make it a good financial model. And once you get to the point where everything makes sense economically, then you just get to practice medicine and not deal with all the headaches that I dealt with for 7.5 years.
I've said before in written and video blogs that I thought direct primary care really was the key to the success of the entire free market movement because it's the first portal of access for patients. And physicians like Dr. Davenport don't have somebody with their thumb on them telling them that, if a patient needs a hernia or a gallbladder surgery, you have to send them here because I'm your employer and that's the best thing for me. He is inclined to do only what is in the best interest of his patients.
Right.
And that's another beautiful thing about his model. Thank you for joining us in this episode with Dr. Davenport. He's the most knowledgeable person that I know about direct primary care, and I wanted to share his wisdom and knowledge with you. Thank you for coming by.
Thanks a lot.
Thanks again for joining us in this video blog series.